in innovation.
Before we leave the balanced budget amendment, the bill that was on the floor yesterday had two other pieces to it. One of them was to go after the budget of the United States and reduce it by $111 billion beginning in October of this year. That has real impact. Part of that impact will be felt on Medicare. Let's just put some understanding into what Medicare is all about. Our colleague from Connecticut did this last night, but it really, I think, is well worth repeating. And so I'm going to just read off some statistics, so please bear with me. In 1965, when Medicare was established, 44% of all seniors 65 and over did not have health insurance. Now, of those 40%, of those 40% of the seniors lived in poverty. So you had heavy poverty and you had no insurance. The two are tied together. You get sick, you lost your money. You spent everything you had. The life expectancy at that period was 70 years. Now, what's happened in the intervening years since 1965? Now, 40 million seniors, nearly every senior in the United States, has health insurance. Just a little health insurance. They have a comprehensive health insurance policy that covers most everything they need: doctors, hospitals, and drugs. The poverty rate for seniors has fallen from 40% to 10%. Why? Social Security and Medicare. Now, they lived to 70 in 1965. Today, seniors live to an average age of 78.5 years. Why? Because they have medical care and they have Social Security providing them with the basics of life. Now, what happens if the Republican budget were to pass and Social Security were to end, not only for those who are 55 years of age now and want to have Social Security 10 years later in their lives when they become 65, but immediately for seniors now? If the Republican bill passed, would become law, that passed yesterday, and the previous one, the budget bill, were to become law, $880 billion would be removed from Medicaid. Medicaid's a different program than Medicare. This is for impoverished people in America, almost all of whom are in nursing homes. $880 billion over 10 years removed from Medicaid. So those seniors, most of whom are women, and I will remind you that we heard from the Republican women here earlier, promoting a program that would cut $880 billion out of Medicaid, 70% of which goes to nursing homes, the majority of whom in those nursing homes are women. This is not a women's program that they've put forward. And the drug side, you were talking about this, Mr. Tonko. This is an immediate reduction in the drug benefits, so that 3.9 million seniors would wind up paying $2.2 billion more immediately if the Republican budget were to go into law because of the reduction in the Affordable Care Act that provided this benefit. These are just some of the things that the American public needs to understand when you get past the sound bites. We must balance the budget, and therefore the balanced budget amendment. Wait. What is it? What does it really do? Terminates majority rule in America and institutes minority rule. So the fundamental of American democracy is trashed. Requires that the budget of the United States be ramped back to the 1965 percentage of GDP before there was Medicare, which inevitably and inextricably means that Medicare is over once that balanced budget amendment passes. Mr. Tonko, please continue on.